I'm Nathan Fountain. I'm a neurologist at the University of Virginia, where I'm also an epileptologist, so study epilepsy, and director of the epilepsy program there in Charlottesville, Virginia. We're excited to study a new technology that hopefully eventually could replace open surgery, brain surgery, in some circumstances. And this technology is called focused ultrasound. And the way it works is by having stimulators on top of the head that direct sound waves into the brain. And where all the sound waves come together in that one spot, it heats up the brain to cause a lesion or ablation. So instead of surgery to remove that spot, the idea is they would stimulate that spot and kill off the tissue there. This technology is entirely external to the head, so it doesn't require craniotomy, that is going into the bone or exposing the brain the way regular surgery does, but instead just places it onto the surface of the scalp and stimulates it through the scalp to cause a lesion in this one spot. And it works very best for things in the brain that are right at the center of the brain because that's where all the beams, all the sound waves come together. And hypothalamic hamartomas are typically almost right in the middle of the brain, and so they're really well suited for this kind of treatment. This is a research study, so it's not part of regular care. The purpose of the study is to determine if this particular technology is safe and effective for this kind of treatment. So not everyone is eligible. It'd be people enrolled in this research study, and the basic criteria is they must be adults, so over 18 years old, up to age 80, and have seizures that are due not just to a hypothalamic hamartoma, but also to other kinds of abnormalities right in the center of the brain. And in addition, they would have to have seizures at least 3 times a month and be taking 2 currently available seizure drugs and have failed, that is, have already tried several other seizure drugs. So it'd kind of be people with typically intractable epilepsy due to an abnormality in the center of the brain. That means that people with temporal lobe epilepsy, which is the most common identifiable epilepsy, wouldn't be eligible for this study. And in fact, anyone with an abnormality on the outside of the brain in the cortex wouldn't be eligible. So it's really just people that have something in the middle of the brain. This technology and method is entirely non-invasive. That means it doesn't violate the skull or the brain or the skin. So in other words, it doesn't expose patients to the risk that would come with that. So bleeding and infection or traversing part of the brain and causing an injury there isn't really a risk to it. The risk to it would be the same kind of things that come from treating the actual abnormality inside the brain. And we'll monitor for those and look to see if those are common. In other similar kinds of treatments that just treat an abnormality in the center of the brain, it doesn't typically cause the same kind of things that open surgery does. So like everything else, it has risks and potential benefits, and we're looking just to see that the technology can actually remove or treat or cause a lesion, as we might call it, in the abnormality. And as a secondary outcome, that is, in addition to that, we're hopeful that it'll also control seizures, and that's why we have a seizure criteria. And we think that being non-invasive will have less risk than invasive surgery, but part of the study is to determine that. So that means during the course, the study will monitor things like the frequency of seizures, of course, but also memory function, other kinds of neuropsychological function, quality of life, and endocrine function, because typically things in this part of the brain affect the endocrine system, and so we'll look for things like that. Yeah, for this study, it requires several visits to the University of Virginia. On the first visit, we would simply make sure someone's eligible, so we'd explain them all about the study, the risks and benefits, and go through the whole consenting process. In other words, tell them everything we can about the study and actually have them sign the consent form. That means they acknowledge that they understand everything about the study. We'd obtain an MRI and a CAT scan. We have to obtain both because that's how we model how the treatment's done. They'd also have blood drawn and undergo some of those tests I just mentioned, so neuropsychological testing and so forth. That probably will actually take a couple of days. Theoretically, it could be done all in one day, but logistically might take a couple of days to get it done. After that, they'll simply count seizures for the next 2 months while we keep track of the seizure. We ask people not to change their other medications unless they really need to, and to context about that. Then after that 2-month baseline period, they'll have to come back, and that's when they get the treatment. So the treatment is like or similar to laying inside an MRI scanner for probably about 2 to 4 hours for most people. But in addition to obtaining the MRI at the same time, they also have to wear this helmet and have a stereotactic frame on their head. Altogether, that takes sort of the course of the whole day. At the end of the day, when the treatment's done, they'll be admitted to the hospital and spend the night in the hospital so we can just observe them. The next day, we'll obtain some more tests, just like we did at the baseline. Then they'll go home. Then they'll return after 1 month, 3 months, 6 months, and 12 months for follow-up. When they return for follow-up, we'll obtain an MRI and do some of those same tests that I talked about. And the study ends at that 12 months at 1 year to see exactly how they do after a year in the study. So they'll have to come to Charlottesville for each one of those visits to have each one of those things done. This technology was just approved by the FDA for treatment of essential tremor. So that's a tremor that people have that we don't exactly know what it's due to, but it's an abnormal circuit in the brain. And the treatment is to provide a lesion, or an ablation if you might call it, but traditional surgery at one tiny spot in the brain. And that was kind of problematic because a tremor, while inconvenient, isn't really life-threatening. And so people didn't want necessarily to have an open surgery. So the alternative to that is this exact technology, focused ultrasound, which is non-invasive and then still causes an ablation in a small spot to treat the tremor. And there's a wide experience now, or relatively wide experience, for treating essential tremor. And so treating HH or other lesions in this study that we're talking about should be very similar. So in fact, it's moving the beam about 2 centimeters from one side to the other to treat the abnormality in the brain instead of treating the part of the brain that causes the tremors. You can find more information about it several ways. The easiest way is to email directly to me, Nathan Fountain at the University of Virginia, and my email is widely available, but it's nbf2p@virginia.edu, a peculiar email address. Or to my research assistant. There's also a web page, the Focused Ultrasound Foundation. This study is sponsored by the Epilepsy Foundation and the Focused Ultrasound Foundation. And so although it's not our website on the Focused Ultrasound Foundation clinical trials page, it'll have a link to us. And finally, they can contact us through clinicaltrials.gov, which is the site for identifying all clinical trials in the United States.